We are going to begin with what we started this week with the nation's top health officials warning of dark days ahead. And unfortunately, that is what we're seeing. Nationwide cases of the coronavirus now top 400,000. Deaths have jumped to nearly 13,000. And despite the signs, the outbreak is beginning to ease here in New York. Yesterday was the state's deadliest day so far, with 731 fatalities. Meantime, new hotspots are emerging. Deaths and infections have nearly tripled in Michigan and doubled in Pennsylvania. But there is also a new glimmer of hope. Overnight, the 76-day lockdown of Wuhan, China, finally came to an end. Our team is spread out covering all of it, and we'll speak with the government's coronavirus response coordinator as well. But first, NBC's Gabe Gutierrez is at a medical center in Brooklyn to start off our coverage. Hey, Gabe, good morning.
Hoda, good morning. The number of coronavirus deaths here in New York City alone has topped 4,000, and this is one of the many hospitals fighting to stay ahead of that curve, and now new signs that the state may be turning a corner. This morning in New York, the death toll is rising.
Out here in the streets, it's nothing but ambulance sirens.
But there is growing hope that the curve is flattening. Hospitalizations seem to have leveled off.
When you look at the three-day averaging of these numbers, the three-day average is down, which is good news.
New York had its biggest one-day spike in deaths, 731 people lost in 24 hours. That's one about every 2 minutes. The mayor here acknowledges the count could be higher if those who died in their homes had been tested.
It's right to assume the vast majority are coronavirus related, and that makes it even more sober, the sense of how many people we are losing.
Authorities are urging people not to do this and have doubled the fine for not social distancing.
If you're afraid of catching something, just stay home.
But Francisco Martinez says he can't afford to stay home. He's an essential worker who has deliveries to make.
We're all still trying because we don't want to stay home and just not make no money. We have to make money either way because we got to survive.
According to the NYPD, more than 7,000 officers were out sick Tuesday. That's nearly 20% of the largest police force in the nation. 2,000 cops have tested positive. Officials say a police communication technician died from the virus Tuesday, bringing the NYPD's death toll to 14. Dr. Nicholas Hernandez got sick too, but he recovered and is back at work.
I tried my best to do everything I could to maintain my distance, but it's still that worry. Am I going to make it through this? Are my symptoms going to get better? Why am I not getting better? It's day 10, it's day 11, it's day 12.
Now reinforcements are on the way, including these soldiers from the 44th Medical Brigade at Fort Bragg in North Carolina. Their mission, to provide critical support to doctors at New York's temporary field hospital at the sprawling Javits Convention Center.
We get called upon to deploy, go overseas, and do missions. But to be called upon to help fellow Americans, I think is really a great thing.
New York's governor required all hospitals in the state to raise their hospital bed capacity by 50%. Maimonides Medical Center here in Brooklyn has raised it by 100%. Despite the potential positive signs of that curve flattening, doctors and nurses here are trying to make sure they're not overwhelmed. Savannah.
All right, Gabe Gutierrez, thank you. And now, as mentioned, to those new signs that this nationwide push to flatten the curve may be showing signs of working. NBC's Tom Costello's got that part of the story for us. Tom, good morning.
Yeah, good morning. So the White House and the coronavirus task force are both saying that there is now evidence coming out of the University of Washington that, in fact, all of these efforts at social distancing may be helping to alleviate the situation, and it's now impacting the projections for where this pandemic is going. This morning, the White House is pointing to some encouraging signs in the battle against the coronavirus.
There's a monster we're fighting. But signs are that our strategy is totally working.
When you look over 3 days, you're starting to see that we may be actually in a series of communities outside of New York and New Jersey and Connecticut, creating a much flatter graph, a much flatter curve.
It comes as one prominent model is now revising down some estimates of both the medical and human cost of the virus, including suggesting some states may reach a peak in deaths sooner than previously forecasted. Critics warn it may be too optimistic and caution against relying too heavily on any one model. The data also assumes states practice strict social distancing until June. Top health officials acknowledge those practices are having a positive impact on all projections.
When I first started here 5 weeks ago, I said that we will win based on what the communities are able to do as a community of Americans. And I think we're all really deeply impressed about what they were able to do.
CDC Director Robert Redfield echoing that, suggesting the death toll could be much lower than the 240,000 deaths projected just last week.
If we just social distance, we will see this virus and this outbreak basically decline.
In Wisconsin, the opposite of social distancing playing out as stunning pictures like these emerge, with thousands of voters braving long lines after the courts blocked an effort by the governor to postpone the state's primaries.
One of the most important times, they're forcing us to come out here in a group. Stop playing politics with our lives.
In Los Angeles, less than a week after recommending residents wear face coverings when they go outside, the mayor is now making that mandatory.
Cover up, save a life. It's that simple.
And as for when things might get back to normal for kids, Dr. Fauci says that while summer camp remains uncertain, the U.S. may be back on track to get back to school.
I fully expect, though I'm humble enough to know that I can't accurately predict, that by the time we get to the fall, that we will have this under control enough that it certainly will not be the way it is now, where people are shutting schools.
Also this morning, the White House is going to ask Congress for another $250 billion for the Paycheck Protection Program. That's the money that goes to the Small Business Administration to help small businesses if they agree to keep their employees on. Already $350 billion has been allocated, but the demand has been overwhelming. In just the first few days, 275,000 applications. Savannah?
Okay, Tom, thank you. And joining us now is Dr. Deborah Birx, the Coronavirus Response Coordinator for the White House. Dr. Birx, good morning. Thanks for being with us.
Good morning.
Well, even though, as we have mentioned, New York and the nation recorded its single largest day in terms of fatalities, there is, in fact, hope on the horizon and the suggestion that perhaps social distancing is having an effect. Can you explain that?
Yeah, we're really proud of the American people. It looks like across the United States, people are following the guidelines, decreasing their social interactions, staying 6 feet apart, washing their hands scrupulously, using hand sanitizer, and critically, not going to gatherings more than 10 people. And I think the American people should be proud of the work that they're doing.
And how do you think it's affecting the curve? I mean, do you see the beginnings of a flattening of the curve, or are we frankly not there yet?
So each of these epidemics are sub-epidemics. So, you know, the New York metro area is different than the LA and Seattle area and Washington area. So Detroit, we're watching each of these, Chicago, each of them watching very carefully for where they are on their curve. And of course, New York and New Jersey, we know Washington and California started very early, went to social distancing very early. Their curves look like they are persistently flat, and that's very encouraging for us. Obviously, New York and New Jersey had what we call a logarithmic rise in the number of new cases, but we're seeing that stabilizing, and that gives us great encouragement. We know that we're seeing still the high levels of mortality, that people succumbing to this illness this week and potentially into early next week, particularly in the New York, New Jersey area. But that reflects individuals that were infected more than 2 to 3 weeks ago, even before some of the strict mitigation started.
Some models, or at least one, now predicts a number of fatalities that's much lower than that original number. I think you said right here on our air a couple of weeks ago that there could be 100 to 240,000 American deaths. Now some of the models that have better data, presumably, now that we have U.S. numbers, are predicting the number could be lower. Do you expect that? Do you anticipate that we might come in under that initial projection of 100,000 to 240,000 deaths?
We're very hopeful because of the seriousness of what the American people have taken these guidelines. What's really important is that people don't turn these early signs of hope into releasing from the 30 days to stop the spread. It's really critical, and you can see the delay. So if people start going out again and socially interacting, we could see a very acute second wave very early. So we are really encouraging every American to continue to follow the guidelines for these 30 days.
That really raises the question whether 30 days will be enough. If 30 days of social distancing will be sufficient to flatten the curve. I believe that one of the models I just mentioned that was optimistic does assume that the social distancing practices go until June. Do you anticipate that?
I think we're looking at data every single day, and it really, obviously we're United States, but each of the metro areas have a different curve. And so we're really looking to see which metro areas have really flattened their curve or coming down the other side and really progressing well with the social distancing. And then really learning from California and Washington State about how different releases could occur by geographic areas. So all of this data is coming together, and as you just said, data is critical. Models are models, but really understanding what happens in the United States is key.
Unfortunately, one of those trends suggests that the African American community in particular has been very hard hit by this virus. Why do you think that is, and is there anything that can be done about it at this point?
You know, we've been very concerned when we saw where the virus was going and the clear evidence from other countries that pre-existing conditions, particularly diabetes, hypertension, obesity, and asthma, were particularly difficult in the disease course once infected. So I just want to make it clear, we don't think African Americans are more susceptible to getting infected, but we do think with those number of pre-existing conditions, and this really brings us back to the social determinants of health, and I think once this is over, we really need to look very carefully into each of those items to really look at what it's going to take to ensure the health of all Americans.
Dr. Fauci said as recently as this weekend, just a few days ago, he said very bluntly, we were still struggling to control the virus. Is that the case? Do you still agree with that assessment?
Well, I think you can see how California and Washington have done. Those were our sentinel communities. Those were our first red alerts that this had reached a significant issue in the United States. And we're really watching them very carefully because they really have seemed to have really strong public health measures and excellent health commissioners that really are changing the trajectory of the epidemic in those regions. So that's what we're trying to learn from. Clearly, there are metro areas that are struggling, and I think that's when we see hospitals in their current state, we all have deep concerns, particularly those of us who come in the medical profession. So we are struggling in the metro areas with the number of people who had been infected a week or two ago or 3 weeks ago, and really working with them to ensure the maximum number receive the optimal care.
And just finally, I mean, we look and we see these heroes on the front lines, healthcare workers going in knowing they're at great risk of themselves contracting the virus, having to separate themselves from their own families in order to protect them, working tirelessly. As a physician yourself, do you have a word for them? Do you have a word of encouragement in this hour of need?
They are humbling to me every day. They make me feel like a humble participant in this entire epidemic. I know many of them. They are amazing, and you know, it's not only the nurses and doctors, but it's everyone in that healthcare delivery system, from the first responders to the respiratory therapists to the individuals in the lab to make sure that all the specimens get run. These are the heroes of America, along with the American people who are social distancing, so that those heroes can finally get a break in the next few weeks.
Dr. Birx, I know it's early. Appreciate your time this morning. Thank you.
Thank you.
Hoda, we'll send it to you.
All right, Savannah, picking up right there as you guys were talking about the true heroes, those healthcare workers. And last night, some New Yorkers wanted to show them just how much they appreciate their efforts. Take a look. That, by the way, group of doctors and nurses and other healthcare workers outside Lenox Hill Hospital right here in Manhattan. And they got a rousing round of applause from police officers, firefighters, neighbors, just people who came out to say thanks to all those people working hard to keep everybody safe and healthy. That's a pretty perfect picture. All right, now time to say good morning and hello to Mr. Roker. Get a check of the weather. Hey, Al.
Hey guys, and Hoda, good to see you as well. Let's show you what we're looking at for today. We do have a line of showers and thunderstorms now pushing through the Appalachians. It's going to be causing some severe thunderstorm warnings to pop up. We're also looking at a severe storm threat for 43 million people. Hail, damaging winds, and tornadoes possible. And for tomorrow into the evening along the East Coast and back through Texas, we've got some severe weather threats as well. This system crosses the Great Lakes, bringing severe storms for the Tennessee River Valley. Tomorrow, rain and snow for New England with gusty storms in the mid-Atlantic. And by Friday, winter storm watches up for Maine, lake effect showers, very strong winds for the Northeast. Look at this. Northern Maine could pick up to a foot of snow. Generally, though, a quarter of an inch to a half an inch of rain for everybody else along the eastern seaboard.